Being a military spouse, since we move a lot around, it's kind of hard to get a good doctor. A lot of times you're seen at the military base. Fortunately, we have the option to be seen by civilian doctors. And seeing Dr. Galan the initial time, it was really, really different. He actually listened. And not only did he listen, he was very interactive. And I mean interactive, he actually looked at the areas where my chronic pain was. He asked questions. He asked for symptoms and feeling and sensation, which is not something you usually get when you initially see a doctor. Most of them just want to sit across the desk from you or in the chair across from the room from you and ask you questions and write on a piece of paper or a folder and go through your past history. He questioned my past history, but he also wanted to look into things that would help me in the future. So my initial visit with him was the first visit of very, very many productive visits that I've had with him. Being in pain is something you don't always want to admit. You know, it's something that's always associated with, I don't know, getting old and collecting Social Security and all that good stuff and smelling like Bengay. But when it happens, and you just want to have relief. You want to keep your regular life going because it takes away something from you when you can't get relief. So Dr. Galan's done a lot of different things to help me. Just starting off with small goals as far as, you know, being able to get up in the morning. There were times when I couldn't fold the laundry or carry the laundry basket. Starting off with small things and allowing the medication to do its work and work with the medication and just achieve smaller goals, which actually helped me to where I can do a lot more. I still have really, really bad days, and that's out of anybody's control. That's just how it is for me and my situation. But I think the biggest thing is to take advantage of the days that you have that are good, that actually I probably will say are provided and actually helped by seeing Dr. Galan in his office and then being able to manage my pain on a monthly basis where I'm able to come in and they ask about my month and how I've been and where's my pain level every single time. To where there have been times where I've come in and my pain level's out of this world and they're able to come to a solution. Dr. Galan, I looked him up before he came and I was very, very impressed with his diversity of what his practice brings. And that was what I wanted to see if it was really true. Because a lot of times you go online and you read something and it's like, oh yeah, it's like this, but then you get there and it's not like that, which was not the case. Dr. Galan's office, from the time you open the door, he's got a great welcoming committee at the front desk that is, for some reason, always in a good mood, always happy, and always willing to help you no matter what. So that was a plus right there. But then in meeting Dr. Galan and the other doctors, it was exactly how it was. You know, they were here to help you. He was here basically to do exactly what his practice was, manage your pain and find a way for you to be able to have a productive life, even if you have to live with pain. Dr. Galan is a very humble doctor. He is probably one of the few doctors that I know that does not have a God complex. He has been very, very humble about what he can do and what he cannot do, to the point of even recommending doctors that are even more qualified than him to help you instead of keeping you grounded without getting you the proper care that he feels that you need. So I would recommend people to Dr. Galan because his overall goal is to get you to a point to where you have a comfortable life, even if you have to live with pain. And I can truly say, not always comfortable, but for the most part, Dr. Galan does a really good job of making sure that he tries to get me there for the most part. There are times when you have to wait a while, but I understand it. I don't know if everybody else does. When you wait a while, it's because someone else is in there with something that really they feel is important, or something that's really bothering them, or they want a solution to whatever's going on, and they're actually trying to figure out something, because I've been that person that's been in there for more than 20 minutes, you know, so I get it and I appreciate it. So I can't really say that there's a downside without actually finding the upside of that downside. So that's why I've been here since I've moved here. And I don't plan on going anywhere.